a word about depression. We use the term perinatal, as all of you know, which covers pregnancy and up to the first year following delivery. So I wanted to mention pregnancy quickly. We are going to focus on the postpartum mood and anxiety disorders, but just know that anything that can happen postpartum can also happen during pregnancy. And you heard during the screening, the film screening, how important that truly is, and many of you already know. When women are depressed during pregnancy, typically they're not taking care of themselves very well, and they are not eating what they should be eating. Typically there's loss of appetite due to anxiety. They are self-treating often, smoking, other drugs, alcohol. And depression in pregnancy, we say, crosses the placenta. Depression crosses the placenta. It's important. So a lot of the women you're working with are thinking, the strongest thing I can do is to get myself through it without any treatment. I can do it. They need to know that that's not necessarily what is best for their baby. They think it is. And treatment, by the way, does not necessarily mean medication either, which often the women you're working with don't know. Sometimes therapy is all that needs to happen, maybe some alternative, great nutrition, some wonderful psychoeducation. But depression in pregnancy is associated with low birth weight, preterm delivery, babies who are small for the gestational age, and a plethora of other issues. Severe anxiety during pregnancy causes the constriction of the placental blood supply, and that can cause all kinds of problems as well. These kids are harder to soothe in general due to the higher cortisol levels. So just so you know, women who are depressed towards the beginning of their pregnancy or about 18 weeks, our research says, they are at a threefold risk for postpartum depression, and women who are depressed towards the end of their pregnancy, and sometimes they've been depressed all the way through, they're at a sixfold risk for postpartum depression. So the baby, in utero, there might be things that we don't want to have happen, and also she's not taking care of herself, the rest of her family. This affects everybody within the family unit, right? So, and she's also setting herself up for depression following delivery. So again, all the bonding and attachment stuff, and not good for anyone. That's why pregnant women really need to be screened at least once a trimester.